Advances in medical science have made it possible for an increase in successful transplantation of human organs and body tissues. Yet in many countries, Kenya included, there is a shortage of organ donors which results to loss of life, and in many cases, it could be avoided. Thank you for finding time to join us. My name is Aida Munzati and Health Nuggets starts now. Well, he says that he got a second chance that he doesn't take for granted. He was only 24 years when he realized he had a kidney failure. His name is Joab Wako, a kidney transplant recipient, and he takes us through his journey.
My story starts in 2015 when I started having nausea, like feeling nauseated. I thought it was something small, and I went to see the doctor. They even thought it was ulcers. I was given some medication, and then I went home, took the medicine, and I didn't feel any better. So now, in fact, I got very weak. I thought that maybe it's an extreme case of something in my stomach. And I go back to another doctor, and they tell me that, hey, here, your blood count, because now HB is very low. So they do a test, and they find out my HB was 3.8. So I was told, hey, there's something even seriously wrong here, because for your blood count to become 3.8, it's something more serious. So they do more tests, and they find out that my kidneys have failed. Yeah, in fact, that I was rushed to the ICU because of that. So on reaching the ICU, they tell me that I'm the youngest person in the ICU, and that they have to stabilize me because now my condition has been, it's so severe that they have to stabilize and get my electrolytes, because the kidney controls the electrolytes. It controls the potassium, sodium, and phosphorus. So they're so badly out that I needed to stay in ICU for the night. So they start doing the tests, and they find out that it's chronic, it's not acute, because there are two main types of kidney disease, chronic and acute. Acute is now your kidneys might wake up again, and then you're fine. Chronic is the one that now, over time, your kidneys are damaged so much that they never come back. So they do the test, and they tell me they think it's chronic and that I need to do dialysis. And at that time, it's so difficult, when a doctor tells you that your kidneys have failed. So they take me into the theater to put a catheter now for dialysis. So they put the catheter, and I started dialysis. And at that time, I still couldn't believe that my kidneys have failed completely. And the only option I had, because I was young, I was 24 at the time, they tell me that it's going to be either a kidney transplant or dialysis. Those are the two options that we have. Everything stops, you can't even think straight, because now when the doctor tells you this is for the rest of your life, at that moment in the hospital room, you can't imagine. It's so hard to understand that I didn't even feel myself, It felt like I was in a movie of myself. Yeah, so that's how it feels when they tell you that your kidneys have failed and it's possibly for the rest of your life. So that's when we started the conversation with my family about kidney transplant. Because I was told I'm very young, and a kidney transplant is the best way to go back to life as before. So I was not here, I was in the US, and I called my family and told them, hey, that my doctor said that a transplant is my best option, and we might need to start talking about who's going to donate a kidney. So my family had a meeting here in Nairobi, and they talked about it, who would donate. Lucky for me, my sister was very touched by it. Me and my sister, we grew up together. I'm the youngest, and we're 4, so she's the one comes before me. She volunteered from the beginning. She told me, hey, this one, if I am compatible, I'll give you a kidney, and we can start the tests. So that conversation of who will donate it's a very hard conversation to start. But if you have a close relative, it's a bit easier, because then they see your journey, they see how dialysis, it takes a lot of your energy. So that's how we started the conversation on our kidney transplant. And started doing now the transplant tests. So other than being healthy, like the whole body check, you have to do tests known as HLA. HLA stands for, it's a human, it's like for your immunity, basically, yeah. So they check that my immunity and my donors are compatible. Because sometimes you meant to be healthy, but then you're not compatible with your donor. Yeah, it's like my body will start fighting a kidney. So we do that test and we're okay. We're given the go-ahead. And then they set a date for when you go with your donor to a council. It's like called an ethics committee. And that day I remember when we woke up early and were taken to, it's a court really, taken to the court, and it's many of you. So all the patients who are doing a transplant are taken together in a bus. So all your cases are heard by the ethics committee to make sure that your donor is not being forced to donate. Because remember, organ donation is about giving freely. It's about giving to help. You know, it's not to sell your organ, or no one should force you to donate. So they now take the donor to the room independently, and me independently, to make sure that there's no forcing. I'm not paying her nothing, or him, the donor. So once they do that interview, you realize that this is a serious thing. First of all, yeah, it has to be under the free will of the person. No one has forced them. So when they realize and they confirm that no one has been coerced or bribed or anything, they give you the go-ahead to do the transplant. And once we passed that, the next day we went for surgery. And it was a 4-hour surgery for each, so I think it was about 8 hours in total. And when I woke up, I had the transplant. I felt so much better, you know, that my body now is able to eliminate waste for the kidney itself. It was working, it worked immediately. We thanked God for that. And the recovery started, you know, the recovery of walking again, because now they start giving you so much fluid. I was being given 4-5 liters a day. My feet were swollen because of the fluid, but the doctors were telling me that's normal. We just want to make sure the kidney is working, so you need to walk. So now I had to stand up, to get out of bed, to walk around the unit, to make sure that I'm exercising, to make sure I'm drinking enough water, I'm eating healthy food with no salt. Yeah, so the recovery started, and within a week, I was feeling a lot better. Within a week, I can say I felt like before I had to start dialysis. Yeah, I had recovered mostly. And then, you know, another thing I remember, your skin, when you have chronic kidney disease, it becomes very dark. And then you start to, it looks like it's pararad, like it's dry. And then my skin started coming back. I felt like myself again. Yeah, within maybe 2-3 months, I couldn't even tell I had a transplant. Yeah.
Well, indeed, receiving a body organ from someone else is an opportunity that shouldn't be taken for granted. I had this saying somewhere that in this world, you are because you give. Brian Dongo donated his kidney to her sister. Let's listen in to his story.
In terms of, say, there's a lot of work involved. So you see there's the financial part, there's also helping them with their emotions, also the physical part where there is organ donation, where someone offers themselves. So chenye tu naweza sema ni which part you see fit for you. Najua labda kuna mtu anaweza taka kudonate lakini mwili yake inakataa, but you can do something for those in need. Hata kama ni kukua there for her or him, in whichever way you can help, it's good to take that chance. You know, that person needs you.
And how was it like for you making that decision that I'm donating a kidney for my sister? Was the decision easy to make?
For me, I'm that kind of a person when people around me feel bad. So for me, the decision from the start was anything I can do to help. So I was ready in my mind.
Mm-hmm.
Yeah.
And how long did it take you to heal?
I guess by the first month I was quite okay. but after the doctor recommends about 6 months, but after like 2 months I was good. It's nitasema nini, it's a blessing kumuona ako poa, ana smile nini, we all wanted, because during her phase when she was sick, sisi wote tuliona vile it affected her, so seeing her back to her smile and back to her normal self, hata akakuwa light skin kidogo, it's a blessing naweza sema. Besides her being my sister, I saw the opportunity, and the humanity in me led me to taking the opportunity and being there for her.
So you can either donate your body organ when alive or dead. Diseased organ donation should be done on the notion of a gift, freely and voluntarily before your death, so that when your time comes, maybe months later, years later, or decades later, your body organ could be used to save many other lives. Well, the World Health Association developed principles and policies to guide medical institutions, medical experts, and physicians as far as organ transplantation is concerned. Well, is the public aware of these principles, and are they aware of the option of organ donation? To help us in this, I'm being joined virtually by Elizabeth Mbogwa, who is an advocate specializing in health law. So we'll just get straight into it. As far as organ transplantation is concerned, do you think that the public is aware of the option of donation? And if they're not aware, what can we do?
All right. So thank you so much for the opportunity, for being here, for what you're doing. So when you ask about whether the public knows about organ donation and transplantation, I could say in the past, no. But now, like what you're doing is one of the ways of raising awareness. So, and a very good opportunity of raising awareness in this area where people don't know much about is mostly when people are developing laws. When you're coming up with a law that is related to organ donation and transplantation, these are very good opportunity to raise awareness. For instance, because this service has been provided for in the law. We have something like the Kenya Patients' Rights Charter that was developed in 2013. This would have been a nice opportunity for the people who are coming up with this policy to tell the public about it, because it is a right and a responsibility of patients. A right by it being a right, it says that each person after their death, they can donate their organs. And the responsibility is expressing your wishes to the healthcare provider who is looking after you at that time. So when they were coming up with this policy, they would have told the public, this is a right we have created right now. You can give your organs upon death, and you have the responsibility of telling your wishes to your healthcare provider. And then when they were coming up with the Health Act of 2017, again, because it is a health right provided for in this act, back in 2017, they would have told the people, we are putting up this part. It is a whole part dedicated to it, part 11. We are putting up this part which talks about organ donation and transplantation. That means you can donate your organs upon your death, and you can discuss this with your family members and with your doctors. So in this way, when we are creating the laws, then we can bring the awareness to people. But currently, other than what you're doing, other than what you're trying to do, like what we did with Joab and other stakeholders, marking the Organ Donation Day for the first time in Kenya on 13th of August. Other than that, there isn't much being done currently.
Okay, so for the recipient and donors, what will you say at transplantation or the benefits of organ transplantation are?
For the benefits of organ donation and transplantation, for the donor does good. He or she is able to give someone a chance to continue with life. Basically before the science advanced, people would have died in situations when now transplantation comes to help. and others, such as those with kidney failure, are on dialysis. So the donor feels that they've done good by prolonging the life of the recipients. The recipients, on the other hand, is able to continue with their life, like the diseases they were ailing from are cured per se, because like, for instance, if you're having heart failure, you cannot live unless you receive a new heart. So for the recipients, they have their lives prolonged, and they're able also to live a life of dignity, because the alternatives per se do not give you a dignified life as such. So once you have a transplant, then you continue with your life, and yeah, that's it. You're healed from the disease that you're healing from.
So for the living donors, maybe you can just tell us, is it legal for someone to sell their organs, maybe a kidney, or should they just do it at will, freely?
All right. It's not legal. It is very much legal. It has been it is illegal in our country. It attracts a fine of 10 years imprisonment or 10 million in fine. And also internationally, it has been made illegal. We have protocols and declarations such as the Istanbul Declaration, which talks about human trafficking, organ trafficking, that is, and organ commercialization, which the declaration says that commercialization should not happen. Like no person should be allowed to sell their organs, whatever it is, be it tissue, that is blood and the rest, or organs, kidney, lungs, hearts, at all. So you should not sell your organs. It has been criminalized in our law, and the Constitution of Kenya allows us to embrace international laws such as the WHO guidelines, that is the World Health Organization guidelines, and such as the Istanbul Declaration, what you referred to initially, the World Medical Association. Yeah, it allows countries to come up with laws to criminalize commercialization of organs. So it remains illegal here in Kenya and all over the world.
So to the donors, what information do you think they are supposed to have when they are donating their organs, and even to the recipients as they receive the organs? What information should they be having?
All right, for donors and recipients, okay, let's start with the donors. One key thing in organ donation, be it living or deceased, is informed consent. Informed consent is where a doctor comes to you and gives you information first, and this information, you should use it reliably to make an informative choice. And then based on this information, you should make a choice. So those are the three things that make information informative. That one, the information must help you in making a decision. And second, you should be able to make a decision based on that information that has been provided for you. So you must understand it and internalize and make a decision whether or not to become a donor. So a doctor should tell you about the risks and the benefits. So this information, it should be understandable by the patient, and also the family members, and because again, if a person dies on without leaving their will, an expression to donate, then the family members can act as surrogate to make a decision on their behalf. So this information is very much important, and it is mostly given by doctors. Me and you can do much in raising awareness, but it's the doctor who should create a rapport between them and the patient and the donor, and tell them, this is what you will go through, this is what the procedure entails. If it is living, should we take a kidney? It is possible for you to live with one kidney. And so, like, just explain what the procedure entails, and until they get to a point where the patient says, yes, it's okay. Otherwise, without this informed consent, then the whole donation, living donation, becomes illegal. And also another principle which guides living donation is doing no harm. Like, a doctor should not carry out a living donation, should not allow a donor to donate their organs in a manner that it's going to cause harm to them. So they cannot allow patients to donate, say, their cornea because they'll become blind, or their hearts because they're going to die, or their lungs because, again, they cannot function without the lungs. But for kidneys and a piece of their liver, then they can allow them to donate because they'll be causing no harm. The liver can regenerate and a person is able to live with one kidney. Yeah.
And what if the donor wants to withdraw?
It's allowed. Revocation. It's called revocation of your intention to donate. It's allowed in the law. Where now this will lead us to the systems of donating. Consent systems. We have the opt-in system and the opt-out system. They both allow a prospective donor to withdraw. If it is opt-in, which says, like I myself, I am opting in to become a donor. So I express my wishes when I am living and say I want to become a donor. So upon my death, the doctors will approach my family members and get their consent. But I have already expressed my intention to donate. For the opt-out system, it says everyone in the country is considered a donor unless they give a contrary interest. They say, no, I don't want to become a donor upon my death. So whatever kind of system that our country chooses to go with, our country chooses. We have opt-in, where Kenyans can express the intentions to donate. So whether opt-in, whether opt-out, you have a choice to revoke your intention to donate.
And if the family objects?
All right, so again, it goes back to the importance of doctors talking with the patients, creating a rapport with the patients, and encouraging the patients to talk about their intentions to donate with the family members. Because it's very difficult for a family that is grieving loss, for you, for the first time, to mention about organ donation. So it becomes very, very difficult. But in instances when you are talking with the patient and the family, when the patient, the prospective donor was in hospital, you as the doctor, you take them through the process of donation, the risks, and then you treat the prospective donor with respect. Then when the person passes on, it becomes very easy for you to introduce this question and these, like, to ask them whether or not they would like their loved ones to donate their organs. It becomes very easy. So the first thing, even so that to avoid the family members from saying no, you should talk to them even before their loved one passes on. So, but when they say no, that is respected. You cannot obtain organs once the family has said no.
Thank you very much, Elizabeth. Maybe you can just tell us a takeaway or any last words from you.
All right. So currently in the country, the laws that are there, I could say they're just intentions to have a donation system in the country. So we should have a specific law, one that will allow the stakeholders, the doctors, policymakers, and other people to come up with policies that are going to operationalize this medical practice further. So we need like policies to explain things like death in our country, because once we define death and once we come up with policies explaining the determination of death, then we can move forward to advance the deceased donation and transplantation. Again, we need to have a law that is going to allow living donations, both related and unrelated, because currently the country only allows for deceased donations, which is not happening. So we need to have a law that is going to explain, that is going to help us explain further what deceased donation means and what living donation, both related and unrelated, means. This way, we are able to even source for finances, because again, it requires a lot of resources. So we are going to have even more doctors delve into this, and they're going to feel protected when they carry out these procedures. So it's only good for the country to have a more specific law, and yeah, we'll just call upon the government to push for a more specific law in organ donation and transplantation.
Well, indeed, from Joab and Brian's experience, it's such an amazing thing to give life to someone else. This has been so enlightening. I have learned a lot about this subject that is not known to many, and also many people do not know how to go about it. I hope that you too at home have learned something. Thank you very much for finding time to join us on Health Nuggets. As always, you can share your comments and questions on our social media pages, and we'll be sure to address them in our subsequent episodes. My name is Aida Munzatsi, and as always, your health matters.